know some of them do. Some of them. Good morning. Thank you for joining us for Making the Most of Medicare, a guide to fall open enrollment 2021. My name is Kris Winterowd, and I'm the Northeast Regional SHIP Coordinator. SHIP stands for the State Health Insurance Assistance Program, and I will be telling you more about that in just a minute. This workshop is designed to help you navigate fall open enrollment, which is the main time each year when Medicare beneficiaries can make changes to their coverage. We'll go over what you can do during that time. Today I'm gonna explain what SHIP and SMP are. I'm gonna go over some Medicare basics. Going to explain what beneficiaries can do during Medicare fall open enrollment, give you some of the fraud red flags so that you're prepared and can protect yourself, and explain how the Aging and Disability Resource Center is helping with open enrollment remote counseling this year. My program is the New Mexico SHIP program, the State Health Insurance Assistance Program. We're a federal and state partnership. We get ongoing training from the Centers for Medicare and Medicaid. We offer free, unbiased expert information and assistance for people on Medicare, their family members, caregivers. We can provide counseling, Medicare counseling, so that you fully understand your choices. I also do a lot of this kind of education and outreach for people, not just during fall open enrollment, but all through the year. If you have questions about Medicare, you're having issues with your Medicare, you need assistance with an appeal or making sure a necessary procedure gets covered the way you feel it needs to be, we are here to help with that. You can always reach us at the Aging and Disability Resource Center, which is the statewide call center for the Aging and Long-Term Services Department. And that number is 800-432-2080. You can also find information about the program, and there's web chat available, as well as an opportunity to email at our website, www.nmaging.state.nm.us. Our sister program is the Senior Medicare Patrol, or SMP. This is the agency that's there to help prevent, detect, and report healthcare fraud. They're also a federal-state partnership. They provide counseling, advocacy, education, and outreach for Medicare beneficiaries and their families and caregivers when there is issues around scams, fraud, billing. And so it's really important to know that there is a resource, because scams and fraud are always, it seems, on the rise, and Medicare beneficiaries are particularly targeted. So if you feel that you've been the target or the victim of some sort of Medicare scam or fraud, please do reach out, and you can contact us the same way, either through the Aging and Disability Resource Center at 800-432-2080, or online at our website, www.nmaging.state.nm.us. All right, now digging into Medicare a little bit, we're just going to go over the parts of Medicare briefly, because I'm assuming that most people who are engaging in this workshop already have Medicare, because this is the time that you'll be getting the information about what your plan's going to be offering for the upcoming year, and you may be thinking about making some changes. Basically, there are two ways to get your Medicare. Medicare is not one size fits all. You can either enroll in what we call original Medicare, which is your Part A hospital coverage, your Part B outpatient coverage, a Part D prescription drug plan, And then you may or may not also have a Medigap or Medicare supplement. With original Medicare, you're getting your health insurance directly from Medicare. And you can see any provider that accepts Medicare. You don't have to worry about networks, whether, you know, if a provider accepts Medicare, you can go to them. You don't have to get any referrals or authorizations. It's pretty straightforward. This type of Medicare, with original Medicare, Medicare pays 80% and you're responsible for the other 20%. That's where those Medicare supplements or Medigap policies come in. They pay your 20% of the covered benefits. It's really important to understand that with a Medigap policy, it doesn't cover anything that Medicare doesn't cover. It's not extra, it doesn't offer extra benefits. If Medicare covers it, your Medigap will pay the other 20%. If Medicare doesn't cover whatever service or procedure you've received, your Medigap policy won't cover it either. But with this type of coverage, generally speaking, people have higher monthly out-of-pocket premium costs, but low to no out-of-pocket costs when they get their medical care. So for some people, this is the way they like to get their insurance coverage. You're not going to have any surprise costs. You're not going to have any high out-of-pocket expenses when you get your medical care, as long as it's covered by Medicare. The other alternative is a Medicare Advantage plan. These are HMOs or PPOs usually here in New Mexico, although there are other options as well, other types of plans. They're purchased through a third-party insurance company, and they bundle together the Part A hospital coverage, the Part B doctor coverage, and a Part D prescription drug plan. Usually these plans have lower monthly premium costs, but your out-of-pocket costs for care are going to be higher because you're going to have co-pays for whatever services you receive. If you have a Medicare Advantage plan, you cannot have a supplement, a Medigap policy or supplement policy. It's illegal to have both. And so you have to choose between having a supplement and having a Medicare Advantage plan. You can't have both at the same time. Often, the Medicare Advantage plans offer additional benefits such as dental, vision, and hearing coverage. You have to be really careful if you join a Medicare Advantage plan for one of those benefits, because if you don't dig fully into the details, you may not be getting what you think you're paying for with those particular benefits. They also often will offer additional benefits like the Silver Sneakers gym program or an over-the-counter drug benefit that people find very attractive. But it's important to understand the differences between these two types of coverage, and not just the advantages but the disadvantages of each type of coverage as well, so that you can make the best choice for your situation. Part A hospital coverage, whether you have original Medicare or an Advantage plan, you're going to have your Part A hospital coverage and your Part B doctor coverage. Medicare sets what the minimum is for that, right? And so Part A hospital insurance is going to cover your hospital stay, inpatient skilled nursing facilities, blood the first 3 pints, home health care, and the home health care benefit covered under Part A is generally acute skilled nursing needs. If you're a doctor, if you've had a surgery or an event and your doctor orders some in-home wound care or physical therapy, occupational therapy, anything like that, that's what's covered under home health care. This is not generally personal care services or for a long-term situation. Hospice care is also covered under Part A. Part B covers your doctor visits. outpatient surgery and supplies, labs, X-rays, MRIs, CAT scans, EKGs, things like that, durable medical equipment, diabetic supplies, not the medication, but the supplies. And there's an array of preventive services that are covered under Part B as well. The Part D prescription drug benefit, in order to get a Part D prescription drug plan, you have to have either Part A or Part B, and they are local. You have to live in the plan's service area. It helps, instead of paying the full cost for the drug, you'll have a copay for your medication. And there's a huge amount of variation among Part D prescription drug plans. That's one of the things that people often shop around for during open enrollment. Part C, just to briefly go over before we skip on to Part C plans, the Medicare supplements or Medigap policies. Generally speaking, that's something that you're going to enroll in when you first start Medicare. If you, when you first start Medicare, join a Medicare Advantage plan, and then sometime during that first year that you're on Medicare, decide that you want to enroll in Original Medicare with a supplement instead, that makes more sense for you in your situation, you can switch over. It can be difficult to change into a Medicare supplement or go back to Original Medicare with a supplement if you drop that, or if you haven't enrolled when you first started on Medicare. We can help talk you through your options if you're wanting to get a supplement after the initial enrollment period. That would be a good thing to call and make an appointment with the SHIP counselor about. If you have one and you want to drop it and switch over to a Medicare Advantage plan, you definitely are going to want to talk with a SHIP counselor about that before you make that decision as well, just because there can be some consequences that maybe you're not aware of. All right, so a Part C Medicare Advantage plan requires both Part A and Part B. You have to have both the hospital and the doctor coverage in order to enroll in a Medicare Advantage plan. Kind of like the prescription drug plans, they're local. And so you have to be in the plan's service area. Not all Advantage plans are available in all areas of the state. So it's important to know how to really see what all your options are if you're thinking of either joining an Advantage plan or changing from one to another. And that's one of the things that we can help with. And again, both the website and the phone number, 800-432-2080, are right here on the slide for you. Okay, during Medicare Open Enrollment, this is the main time each year when Medicare beneficiaries can make changes to their plans. It runs every year from October 15th to December 7th. If you have a Medicare savings program, if you have Medicaid in addition to the Medicare, you may be able to make changes at other times of the year, but for most people who just have Medicare, this is the time. This is the time to make your changes. How can we prepare? How can we know whether we need to make changes or not? Well, during the month prior to open enrollment, plans are going to send you a document regarding your coverage for the upcoming year, either an annual notice of change or an evidence of coverage document. And you'll be getting this from your plan, either your prescription drug plan or your Medicare Advantage plan, depending on what you're currently enrolled in. And so you're going to want to take a look at that. There can be significant changes from year to year in what your plan covers and how it covers things, particularly with medications. Plans can change their formularies. So a drug that you've been taking may not be on the formulary for the upcoming year, which is really going to have a big impact on your costs. Plans can actually withdraw. I know there's at least one plan here in New Mexico that is leaving the state, and so it won't be available anymore. Everybody who has that plan is going to have to find a new plan this year. They can also change their premiums. There's a lot of things that can change. So it's important to pay attention to those documents that you get in the mail. You should be getting it, you know, anytime from the beginning of September through the first week in October. Also, your health may have changed in the past year. And a plan that worked for you just fine may no longer work as well given your current medical situation, the medications that you're taking. And you have this is a great opportunity to think about your upcoming health needs in 2022 and make sure you have a plan that's really going to be best suited for what you're going to need. The information about the plans is available publicly to everyone on the Medicare.gov website. And I'm going to show you what that looks like in a little bit. It's pretty easy to go in and use the plan finder, although the amount of information that's there can be really hard to digest. That's one of the reasons that during fall open enrollment, our program offers free Medicare counseling from October 15th to December 1st. And you can make an appointment to go over your needs with a counselor starting on October 1st. You make an appointment by calling our 800 number, the 800-432-2080. They'll be taking appointments starting October 1st. Okay, here's what it looks like. If you wanted to go in to Medicare.gov and check it out for yourself, the information is all right there. You don't need an insurance broker or agent or even a SHIP counselor to help you with this. You can just go find it yourself. I always recommend to people that they don't just Google Medicare, because you're going to get 8 million copycat sites. Please, anytime you go to a website, a Medicare related website, and if it asks you for any personal information up front before it'll let you into the website or give you information, close it immediately. Don't do that, because there's a lot of sites out there that are really looking to get some of your personal information, and your Medicare number, even though it's not your Social Security number anymore, definitely counts as personal information. You don't want to put it out there on the internet willy-nilly. So I always recommend to people that they actually type www.medicare.gov into the address window at the very top of their computer window. Don't type it into the search with a little magnifying glass. Type it into the address window, because that'll take you directly to Medicare.gov. And it says, when you get there, the official government site for Medicare. Okay. Anything else you don't want to, I don't even go there. Okay. And this is what it's going to look like. It's going to have, right now, I made this screenshot of what it looks like this morning before the presentation, so that you would have the most accurate, you're in the right place if you see the person's hands with their Medicare card. You can look at plans by just clicking on this little briefcase icon just below the picture. And you can go in there, and without logging in, without getting any information at all, you can look at what Medicare plans are available in your area. It'll ask for your zip code. It'll ask for some basic information such as, are you receiving any assistance from Medicaid? Because that's going to help narrow down to the plans that are going to be most useful to you. And in order to get any really helpful information, you are going to have to put in a list of the medications that you take, because how any particular plan covers your drugs is probably the most important thing for your bottom line, what your medical costs are going to be for the year. If you don't take any medications, it's super easy. You can just tell it that you don't want to see drug costs because you're not taking any drugs. But if you do take medications, you're definitely going to want to put those in. If you take a lot of medications, or just in general, if you're wanting to manage your Medicare online, I highly recommend that you go ahead and select the blue button, log in, create account. Creating an account on Medicare.gov is extremely helpful. Medicare has all of your information already. This just provides you a way to access it. If you create an account on Medicare.gov, when you go in through your account, all of your medications are already going to be there, and it makes doing a plan search pretty simple and straightforward. You can also verify your Medicare coverage, and any letters or documents that have been sent to you by Medicare are going to be accessible through your account as well. So if you're comfortable with computers and you like being able to manage your insurance that way, this is a great opportunity. And you can see that there's a lot of things that you can do from this website. If you're new to Medicare, you can click on the Get Started Medicare with Medicare, this little icon here, and get a lot of information about the things that you can do with your coverage and some of those preventive services that I mentioned earlier. You can find providers, and there's just a lot that you can do through this website. If it's a little overwhelming for you and you want somebody to guide you through it, again, the State Health Insurance Assistance, or SHIP program, is here for you. I do this with people all the time, just to help them orient them to how to manage their Medicare and give them the confidence that they need to move forward with this. When you do a plan comparison on Medicare.gov, you can do a side-by-side comparison. And I just wanted to show you what it looks like. You'll, if you currently have a plan, that'll be the first option. Your current coverage is going to come up first on the plan finder. And then you can do a side-by-side comparison with two other plans to help you really evaluate how well each might work for you. We can see just kind of with this brief example that I have here, that the WellCare plan has a $13.20 a month premium. The Cigna plan, the next one over, has a $22.10 a month premium. And the SilverScript has a $23.30 a month premium. They have different deductibles. Both the WellCare and the Cigna have a $435 a year deductible. And with SilverScript, that goes down to $315 a year. In order to really see how these plans compare with each other, we'd have to scroll down through the details of the plan in order to see how they compare. Looking at just the premium is not enough to determine how well a plan is going to work for you. You really have to look at the details. Okay, so that's just kind of a brief overview of what you can do, how you can get into that Medicare.gov website, and how you can look at what plans are available for yourself. So what are you going to do with this information? What can you do during open enrollment? Well, during open enrollment, you can change from original Medicare to a Medicare Advantage plan. If you have a supplement, that's something that you're going to want to consider carefully. And we in the SHIP program would be very happy to talk with you about that. You can also change from a Medicare Advantage plan back to original Medicare. You can switch from one Medicare Advantage plan to a different one. And you can switch from a Medicare Advantage plan that doesn't offer prescription drug coverage to a Medicare plan a Medicare Advantage plan that does. You can also switch from a plan that offers drug coverage to one that doesn't. I would encourage you to be really careful about that. Even if you're not taking any medications right now, it's a good idea to have a prescription drug plan, not just because anything can happen. If the last 2 years has taught us anything, we know that anything can happen at any point, right? We have insurance not just for our current needs, but for emergencies and things that may change, right, for us, particularly with our health. So there are certain circumstances under which it may make sense to not have prescription drug coverage in your plan, but that is pretty specific, and I would feel so much better if you called us and talked to us about it before you did something like that, just to make sure that you have the full coverage that you need and you don't expose yourself to any penalties, because going without prescription drug coverage at all will, if you did then eventually decide to enroll in a prescription drug plan, your health needs have changed, you're taking medications now, you will have penalties if you haven't had coverage, if you had a gap. So please don't do that without talking to somebody, preferably somebody from our office, because we are unbiased and are just here to make sure that you have the best medical options with your insurance. During open enrollment, you can also join a Medicare prescription drug plan if you haven't had one. You can switch from one prescription drug plan to another one, and you can drop your coverage if that's what you decide to do. So there's really a wide variety, depending on what you currently have with your Medicare, what your options may be for the coming year. When you're looking at a new plan, whether it's a prescription drug plan or a Medicare Advantage plan, it's important to really think about whether the providers that you want to continue to use, whether it's a pharmacy or a particular doctor, are your providers in network for the plan that you're considering? Are your drugs on the plan's formulary? Is your pharmacy preferred for the plan? Boy, there is a big variation in costs of prescription drugs, depending on whether the pharmacy you go to is out of network, a standard in-network pharmacy, or a preferred in-network pharmacy. It can have enormous ramifications for your monthly costs. What additional benefits are offered by the plan? If you're looking at a Medicare Advantage plan, does it have the additional benefits that you're looking for? And how will changing plans affect your costs month to month and, for the year as a whole? A SHIP counselor can really help walk you through all of these issues if you're looking at changing plans. We're happy to help you with that. And again, we are starting to take appointments on October 1st, which is coming right up. And the open enrollment starts October 15th. Boy, my husband dreads open enrollment every year because everybody starts seeing a gazillion Medicare ads. And for him, what that means is I start yelling at the TV a lot because they drive me crazy. So it's really important. The better you understand your Medicare, the more protected you are from scams and people who are, trying to commit fraud during open enrollment or any other time of the year. So how can you help protect yourself from Medicare scams, particularly during open enrollment? Well, it's important to know what plans are allowed to do and not allowed to do. There's some red flags to watch out for. So plans are allowed to send you emails and direct mailing. So you can get And they come out of the woodwork, especially the Medicare Advantage plans. They really want you to, they're going to make you think they're the best thing since sliced bread, right? During open enrollment, you're going to get a lot of junk mail and emails if you've provided email. That is allowed. They're not allowed to call you on the telephone or to visit you in person to market their products unless you've previously given them permission to do that. Plans who send emails must provide an opt-out option. So if you're getting emails from somebody and you don't want to do that, you should be able to opt out of them. What you really want to disengage immediately if somebody tells you that they represent Medicare and want to offer you something for free, right? Whether that's in person or on the telephone, right? Just hang up immediately or walk away. Medicare does not send out representatives. I work for the State Health Insurance Assistance Program. I'm a Medicare expert and I get training from the Centers for Medicare and Medicaid, but I do not represent Medicare. I actually represent you in helping you look at your Medicare options. So if someone calls you or visits your house without your permission to offer services or equipment, close the door, don't even talk to them. If somebody offers free consultations only to people with Medicare and asks for your Medicare number, that is so unlikely to be legitimate as to disengage immediately. And you can always, if somebody's trying to talk to you and you're like, well, that sounds like a pretty good deal, maybe I should think about that, but you want to protect yourself from scams, you can always call the Aging and Disability Resource Center or talk to a SHIP or SMP representative, 800-432-2080, to check out whether it's legitimate or not. I do get these calls from people that I've worked with who will call me and say, oh, somebody called me and they say they're from this organization. Should I trust them or not? We are happy. If you have those kind of questions, give us a call. And if somebody tells you that you're going to lose your Medicare unless you do something with them right now, that's just false. So you can feel good about hanging up on them or walking away. Medicare is not going to use scare tactics on you. And if you want to find out more about this, there's a link down here below to Medicare Interactive, which is a great organization that offers a lot of really easy, consumer-friendly information. A lot of times you might go to the Medicare.gov and try to read what they say, but it's so thick with jargon that you're like, that didn't clear things up for me at all. Medicare Interactive is another great resource for that. Okay. Right now, during fall open enrollment, we are offering SHIP counseling. We're doing everything remotely this year again due to the pandemic. In the past, we travel around to different communities and have appointments and meet people in person at senior centers or other community locations, but we're not able to do that again this year. So we are doing everything over the telephone. Counseling is still available, but it's available by appointment on the telephone. So how do we make the most of that time that we have? Well, I'm going to show you in a minute a beneficiary planning tool that we developed to help people have all of the information they need to be able to really do a plan comparison as efficiently as possible. When you call to make an appointment, you'll be offered some pre-counseling, and our volunteers are helping us with this, and they'll ask you some preliminary questions in order to have as much as possible in place so that when you're actually speaking with the counselor during your appointment, we'll be able to get right down to business. If you have created an account on Medicare.gov, Be sure to tell the counselor, the pre-counselor, that information, because you won't necessarily need to provide a list of all your drugs. If we're able to go in and do the plan search through your account on My Medicare, then all that information is already going to be there. The ADRC is, you can have live or callback assistance during open enrollment. And that, again, is the same number, 800-432-2080. The options counselors who answer the phones at the ADRC are also trained SHIP counselors and can assist you with your Medicare options. They can also help you get an appointment with a SHIP counselor. The call volume at the ADRC does go way, way up during Medicare Open Enrollment. So sometimes there can be long wait times. You can make a SHIP appointment either by calling the ADRC at 800-432-2080 or by going onto the website and either sending an email or doing a web chat to make an appointment for fall open enrollment with a SHIP counselor. If you go that route, then you're not going to have to wait on hold because the SHIP counselor will call you at your appointment time. So the beneficiary planning tool, this is for you, right? You don't need to send this in. You're not going to provide this to the counselor. It's just a way for you to gather all of the information that you're going to need to make the appointment go smoothly. And that includes your basic demographic information, a drug list with dosages, and it's just as designed to help us be able to get started and spend the most time actually looking at the plans during your appointment rather than getting all this basic information input so that we can see the plans. Again, if you have an account already on Medicare.gov, this is already going to be there and it's really going to help the appointment go smoothly. And I know you can't see this, but this is kind of just what that looks like. It's pretty basic and it's pretty straightforward, and it's just designed so that you have the information that the counselor is going to ask you for when you do either the pre-counseling or the SHIP appointment for Medicare Open Enrollment. This is something that is available either in a hard paper printed copy or on a PDF. And Barbara, for our presentation today, I did provide this to Bernadette at the Senior Center. So if you're interested in it, she should be able to provide it to you. And you can also contact me. My contact information will be coming up. Okay. That was a lot. Does anybody have any questions? No? All right.
Hospice was covered under Medicare. How long?
Hospice is covered under Medicare Part A. I would have to look up if there are any limits. I'm not sure that there are, but that's definitely something that we would need to look on Medicare.gov to see what the specific limits are. I don't have that at the top of my head.
Thank you.
But you can find that information pretty easily on Medicare.gov. All right, this is my contact information. Again, my name is Kris Winterowd. I'm the Northeast Regional SHIP Coordinator. My direct work cell phone number is 505-470-4443. And you can reach me by email at kris.winterowd@state.nm.us. Happy to talk with people and answer your questions. Now, Medicare Open Enrollment starts October 15th and it goes through December 7th, and I am going to be in appointments all day, every day during that time. So if you reach out to me during open enrollment, I will try to get back to you whenever I have a moment, but I will not be freely available. You can always reach someone at the ADRC at 800-432-2080. And as I mentioned before, that is the call center for the Aging and Long-Term Services Department. And you can access all of Aging's programs, including SHIP, SMP, care transitions, ombudsmans, adult protective services, all of the Aging and Long-Term Services Department programs are accessible through the ADRC, and it's just that one number, 800-432-2080. If you haven't gone to our website, I highly recommend it. We just updated it a couple of months ago, and I think it's pretty easy to use. There's lots of information, including about upcoming events. For example, next week, the first Wednesday of every month, we offer a Medicare 101 workshop that just goes over the Medicare basics, and other workshops are available there with links and information about how to participate under our upcoming events. It's a good thing to take a look at. Okay. Let me